18 weeks fetus. Congratulations, you are halfway through the difficult but also full of exciting pregnancy experiences when reaching the 18th week of pregnancy. Although the entire pregnancy period consists of 40 weeks, in reality from week 138 you may already have signs of labor. The estimated due date is only to help you better prepare for the arrival of your baby. Don't expect your baby to be born on your due date because it is common for mothers to give birth earlier than that due date. If your menstrual cycle is irregular or you are not sure when you will have your baby, an ultrasound will help you to predict the fetal development and the date of birth. From the 18th week of pregnancy, due to the body's gravity changing, you will have a slightly different gait than usual to adapt to the growing belly. Pay attention to your posture and don't stoop. If you work in an office, adjust the chair so that it is comfortable to reduce back pain during pregnancy. You should also arrange your work reasonably, arrange a workplace convenient for commuting, and take advantage of rest when possible. Say goodbye to high heels. You should only wear shoes with low and flat soles. From the second stage of pregnancy, due to hormonal changes in the body, your feet tend to swell, so you should buy shoes with larger sizes and should choose low soles to increase the stability of the legs when having to carry the pregnant belly. Most people around are concerned about the health and development of the baby in your belly. Some people will like to touch your belly to feel your baby. How you deal with such situations is up to you. Maybe you will feel very happy. On the other hand, if you don't feel comfortable, tactfully talk to people about what you think. Pregnant women often tend to protect the fetus and try to minimize the negative effects on the baby. This is completely normal. Physical changes at 18 weeks of pregnancy. At 18 weeks pregnant, don't worry if your ultrasound shows that your placenta is at the bottom of your uterus. Although the placenta is firmly attached to the wall of the uterus, your uterus will still get bigger to accommodate your baby's growth, so it doesn't have to be fixed in place. At this point, the uterus is as high as the navel. Your abdomen will be more visible, especially the area from under the arms to the waist will become larger. If this is your second pregnancy, your belly will now be even bigger because the abdominal muscles are increasingly stretched, not as firm as before. Your heart works harder to pump about 7 liters of blood per minute to go around your body. Due to the effect of hormonal changes during pregnancy, blood vessels will expand to help blood flow more easily. This puts pressure on the veins and is the cause of varicose veins and hemorrhoids during pregnancy. However, these diseases will subside after the baby is born, so don't worry too much. Sometimes you feel a burning sensation around your chest, armpits and groin area. Your body temperature rises a few degrees above normal, making you more prone to sweating. Therefore, you should choose underwear that is the right size and made of breathable cotton, not necessarily beautiful, because it is important that you feel comfortable. Over 50% of pregnant women face melasma during pregnancy. For the most part, during pregnancy, women's skin becomes dull, large pores, oily T-zone, skin on the cheekbones appears melasma. The reason is due to hormonal changes in the body that cause skin pigmentation disorders. Melasma during pregnancy is just a normal physiological phenomenon, and most of these melasma will soon disappear after the baby is born. Therefore, pregnant women should not worry too much, affecting their health. If you want, you can use a little foundation or concealer to cover up unwanted dark spots. In addition, you should use sunscreen when going out. The UVA and UVB rays present in the sun will make melasma worse. Dizziness is quite common during the second and final stages of pregnancy. You should not stand for too long or suddenly get up while lying down. Give your body time to adjust to the new position. Emotional changes. From the 18th week of pregnancy, many couples worry about what the birthing process will be like and how they will be in their new role. All of these worries are completely normal. Feel free to talk to your doctor about your concerns to receive the most useful answers and advice. If you have an ultrasound scheduled for this week, You'll probably feel more connected to your baby than ever since this is the first time you've seen your baby. Many women can only breathe a sigh of relief when the ultrasound results show that their baby is developing normally. This is also a very common psychological development. In dangerous and urgent situations, a mother's instinct always makes pregnant women put their hands on their stomachs to support and protect their babies. Your husband is just getting a feel for the baby through your changes in pregnancy. So give him a chance to get closer to your baby. Don't forget to schedule an appointment so he can take you to your ultrasound and take antenatal classes together. Thanks to that, the future father not only knows more new things, but also can find many interesting answers for taking care of you and your baby in the future. Changes in the baby. When the fetus is 18 weeks old, the baby's hearing has been formed. The baby can hear the noises outside the uterus as well as recognize the mother's voice. So you should talk to your baby often so that when he is born he can recognize your voice. Fetal week 18 is about 13.5 centimeters long from crown to rump. A thin white layer known as the umbilicus covers the entire body to help protect the skin in the amniotic fluid environment as well as help the baby move more easily. Right now, your baby is surrounded by 320 milliliters of amniotic fluid whose temperature remains slightly above your body temperature. This temperature will help keep your baby warm. The feeling of belly machine is no longer vague. Kicks and acrobatics show your baby is growing, and your baby's active activity is a lovely way to let you know that your baby is healthy. Tips for pregnant mothers at 18 weeks. If you are worried about varicose veins, wear maternity stockings regularly to support your legs and support your lower abdomen. Take advantage of rest, relax your limbs when possible, and avoid standing for too long. Ensuring a high-fiber diet and drinking plenty of water will help you get rid of hemorrhoids. Fiber is found in legumes, whole grains, vegetables, and fruits. In addition, you should not try to hold back when there is our need to go to the toilet, otherwise in the long run, it will cause unnecessary diseases. Join antenatal classes right away to help you prepare the best for your baby's arrival. If this is your second child, you should still attend this course to add the most up-to-date knowledge for pregnancy and childbirth. You should also read books and visit trusted websites to learn more helpful information about changes in pregnancy, labor and postpartum care. Back pain is a very common ailment during pregnancy. So, learn how to protect your back and practice properly to reduce back pain. Daily activities such as carrying water, carrying children and moving heavy furniture should all be avoided during this period. If you have back pain, take a warm bath, apply heat, and do gentle exercises. These exercises will help you effectively relieve pain. If your back pain persists, you should see your doctor for physical therapy. During the 18th week of pregnancy, the mother may experience blurred vision and dry eyes due to pregnancy hormones. The mother has dry eyes due to a decrease in the hormone that stimulates the production of tears, causing the fluid in the eyes to increase. The mother's eyes is to change, leading to farsightedness or nearsightedness. After the birth, this phenomenon will go away. The mother's vision will return to normal and clear. However, you need to call your doctor immediately if your vision becomes blurred. Often you see particles or spots, or double vision for 2 to 3 hours. When standing for a long time, or after suddenly standing up, you may experience fireflies in your eyes. This is a fairly common phenomenon, but should also be reported to your doctor at your next visit. Test at 18 weeks of pregnancy. Some tests your doctor may perform during 18 weeks of pregnancy, checking for sugar and protein in the urine. Measure weight and blood pressure. Check the size of the uterus by external palpation. Check fetal heart rate. Check to see if your hands and feet are swollen or varicose. Measure the height from the bottom of the uterus. Like, share and subscribe to update baby care experience. BABYANDI, the journey of being mommy.